What is Tylenol and how it's used? Tylenol is an over-the-counter medicine used to treat reduced symptoms of pain and as a fever reducer. Tylenol may be used alone or with other medications. Tylenol belongs to a class of drugs called analgesics. Uses: temporarily relieves minor aches and pains due to the common cold, headache, backache, minor pain of arthritis, toothache, premenstrual and menstrual cramps, and temporarily reduces fever. What are the possible side effects of Tylenol? Tylenol may cause serious side effects including rash, itching, or swelling, especially of the face, tongue, or throat, severe dizziness, and trouble breathing. Get medical help right away if you have any of these symptoms listed above. The most common side effects of Tylenol include nausea, stomach pain, loss of appetite, itching, rash, headache, dark urine, clay-colored stools, and yellowing of skin or eyes. Dosage and administration. Adults and children 12 years and over take 2 caplets every 4 to 6 hours while symptoms last. Do not take more than 12 caplets in 24 hours. Do not use for more than 10 days unless directed by a doctor. Children 6 to 11 years take 1 caplet every 4 to 6 hours while symptoms last. Do not take more than 5 caplets in 24 hours. Do not use for more than 5 days unless directed by a doctor. Warnings. Liver warning. This product contains acetaminophen. Severe liver damage may occur if adults take more than 12 caplets in 24 hours, which is the maximum daily amount. Child take more than 5 doses in 24 hours, which is the maximum daily amount. Taking with other drugs contains acetaminophen. Adult has 3 or more alcoholic drinks every day while using this product. Do not use with any other drugs contains acetaminophen, prescription or non-prescription. If you are not sure whether a drug contains acetaminophen, ask a doctor or pharmacist. If you are allergic to acetaminophen or any of the inactive ingredients in this product,